Okay, this is Miss Alls. This is Shauna Appalese again. This is Miss Alls. She's already in the left Sims recumbent position. We're going to go ahead and expose the necessary area. But this is a pre-filled enema. You're going to have the pre-filled enema and your lube. You're going to need towels and your stethoscope. The patient's abdomen has already been assessed in the previous video. I'm not sure if I need to do that again. Um, the pre-filled enema comes like this. What you're going to do is remove the plastic cap, lubricate the tip, expel all the air from the enema, insert the tip unless you meet resistance. If you do, you pull back, but insert the tip towards the umbilicus and you roll to expel all of the fluid. You position the patient back into a comfortable position. Can you roll back on your back, please? And if we've inserted the enema, we'll have her hold there for 30 minutes or so, as long as possible, and then we'll go ahead and chart and document the results, what we observed from the enema. Shauna Appalese, chaining a colonoscopy bag. Ms. Alls, can you please verify your name and date of birth?
Tiffany, 2685.
Okay, awesome. I'm going to go ahead and assess your bowel sounds. Okay. Let me know if there's any pressure or discomfort. Are you okay?
Okay.
Are you comfortable?
I'm good.
I see your bag is 3/4 full. So we're going to go ahead and change that.
Okay.
The equipment you need will be a colostomy bag, a colostomy wafer, a skin prep, maybe some towels or cleansing utensils. What you would do is measure how large the ostomy is before you start, and you would cut the hole in the middle. Careful not to make it too big or too small. There are measuring apparatuses, but I do not have one available. But this is what it looks like once you cut it. So once it's cut, you remove the old bag. You perform stoma care by cleansing the stoma. Then use a towel. You would cleanse around the stoma, careful with the skin. Once that's done, I like to actually put mine together before if I need to change both, because there's less pressure on her abdomen. It is less painful and easier for me. You remove the backing, then you would get the stoma paste. Use the stoma paste, make it toothpaste thick around the edges. You would apply it to the stoma, holding it so it would dry and there won't be any leakage. Then you will go ahead and dispose of the old bag and the old wafer in the proper toiletries. Once you've done that, you remove your gloves and perform hand hygiene. And make sure your patient is comfortable and that there's no discomfort from her skin or due to the procedure. Shauna Appalese, Harrison Flush. Hello, Miss Alls again. Can you please verify your name and date of birth for me?
Tiffany, 2685.
Okay, awesome. Hand hygiene has already been performed. Doctor's orders have already been verified, and patient has verified her name and date of birth, which is two identifications for her. We're going to go ahead and assemble our needed material. We're going to have between 100 and 200 cc's. In our case, it's 200 cc's per the doctor's orders. We're going to go ahead and get our lube as well, and our towels. Okay, we're going to go ahead and please ask our patient to roll to her left side. Oh, I'm sorry, Miss Alls. Let me check your stomach before we do that. and make sure it's still needed. When was the last time you had a bowel movement?
About a week ago.
A week ago. Wow. Are you in any pain?
A little bit.
A little bit. Okay.
Discomfort.
I can understand. I'll make this quick. Okay. And push, push, push. Any pressure? I hear a lot of bubbles. A lot of bubbles, yes. If I can have you roll to your left side now, please. Okay, and bend your right leg. Thank you. We're going to go ahead and expose the needed area. And just the needed area. We're going to go ahead and use our waterproof pad, which is what we have today. A nice little towel. Going to go ahead and perform hand hygiene again and glove. Okay, so we have our 200 cc's. And we've already gone ahead and lubed our tube. We're going to go ahead and insert our tube into our patient. And we're going to gently open the clamp while the bag is at her waist level. And we're going to lift the bag and put the bag up and down, allowing the solution to flow in and out of the bag at least 5 times or up to 20 minutes. Once the bubbles cease in the bag, then the tube is clamped and removed. Okay, then we reassess our patient and document our findings. Then hand hygiene is performed. You check your patient's comfort level and you exit the room.